All right, welcome to this explainer. Today we are going to completely shift how you think about sleep breathing. I mean, most of us picture sleep apnea as just someone snoring loudly, maybe waking up kind of groggy the next day, right? But we're going to dive way beneath the surface here to build a much deeper, really wholesome understanding of what is actually failing in the body, why it absolutely matters, and most importantly, how to fix it. So I want you to think about this paradox for a second. You can have two totally different people making the exact same racket in their sleep, right? But one of them wakes up perfectly healthy, while the other is quietly developing a severe cardiovascular risk. It's crazy. If sleep apnea was just a snoring problem, well, they'd be equally at risk. But they're not. And that's because the noise, it's just a symptom of a much more complex system failure. You see, snoring just means the airway has become a little turbulent. It's kind of noisy. It's basically like water flowing loudly through a really narrow pipe. But obstructive sleep apnea, or OSA, that means the airway has crossed a truly dangerous threshold. The pipe doesn't just get narrow, it literally collapses. It completely stops the flow, which puts massive, repeated stress on the pump.
So let's start with part one, the physics of sleep. A lot of people tend to imagine their throat as this rigid metal tube, but actually, it's a really soft, highly vulnerable structure. Think of it less like a metal pipe and much more like a flexible, lightweight shopping bag. If you actively hold the bag open, air moves in and out super easily, but the second you let go, the sides just crumple right inward. Your airway actually relies entirely on your waking muscle tone to act as the support that keeps that bag propped open.
The crazy thing is, just being awake is what actively keeps you breathing. Going to sleep acts exactly like, well, removing a leg from a wobbly chair. If nobody is sitting on the chair, you might not even notice the leg is missing. But the very moment the load shifts, boom, that hidden instability is completely revealed. As your muscle tone drops during sleep, that vital support holding your shopping bag airway open simply fades away.
And it's really not just about having a narrow throat. It's all about these invisible loads pressing down on it. We're talking about factors like neck soft tissue mass, maybe a recessed jaw, high nasal resistance, or honestly, even just sleeping on your back. All of these things add physical pressure. Imagine a bridge that's perfectly safe under normal traffic, right? But if you overload it with too much extra weight, it's going to eventually buckle. These anatomical factors act exactly like that extra weight, until the airway just outright collapses under the pressure of sleep.
Moving right along to part two, the exhausting rescue cycle.
Now, that initial collapse, that's really only the beginning of this relentless, super fragmented cycle of recovery. Check this out. Step 1, the airway closes. Step 2, your oxygen drops and your carbon dioxide spikes. Step 3, your brain essentially panics and triggers an arousal, waking you up just enough to restore that muscle tone. Step 4, the airway finally opens and you take a breath. But then comes step 5. You fall right back asleep, the muscle tone drops again, and the whole cycle repeats, just over and over and over.
Think about it like your phone constantly dropping its Wi-Fi signal all night long. It drops, reconnects. Now, each little interruption might only last a second, sure, but the constant failing and searching, it completely drains your battery, and nothing actually downloads. That's exactly what's happening with OSA. Because of that constant resetting, your brain and body literally never fully settle into a deep, restorative state of rest.
You have to remember, your brain's arousal response is actually trying to save you here. It's kind of like a smoke alarm protecting your house. But if you have too little arousal, the airway stays closed for a dangerously long time. On the flip side, though, if that alarm is way too sensitive and it's constantly going off for just the slightest little narrowing, well, it completely ruins the house, right? It destroys your sleep quality entirely.
Okay, let's jump into part 3, symptoms versus hidden harm. So counting those breathing pauses is really just like counting how many times a bridge shakes in an hour. I mean, it's useful for sure, but it's totally incomplete. We have to look at these deeper dimensions of severity. We need to know the depth of the oxygen drop, the actual duration of the blockage, and the arousal burden on the brain. Actually, a high frequency of really short, mild events might be way less dangerous than a much lower frequency of massive, prolonged oxygen drops. It's all about the actual physiological stress.
This is where it gets kind of wild. Someone feeling totally exhausted and someone else feeling perfectly fine, they could actually be at the exact same risk for a severe cardiovascular event. Let's look at the sleepy patient. They're suffering from a massive arousal burden. Their sleep is literally shattered, so of course they feel terrible. But then you have the high-risk patient.
they might actually sleep right through massive oxygen drops without ever waking up. So they feel totally fine, but their heart and their blood vessels are taking a silent, violent beating all night long.
And, the risk isn't symmetric across the board. If a patient already has hypertension, maybe atrial fibrillation, a history of stroke, or diabetes, the stakes are just vastly higher. Look, in a healthy person, sleep apnea is definitely a strain. But in someone dealing with these pre-existing conditions, those repeated oxygen drops and adrenaline spikes act as this incredibly dangerous chronic stressor. It's actively pushing an already fragile system right toward total failure.
Which brings us to our final section, Part 4, the treatment trade-offs. Now, a CPAP machine is mechanically perfect, right? It just blows air to basically splint that vulnerable shopping bag airway open, and it perfectly replaces the missing muscle support that sleep took away. But seriously, what good is a perfect mechanical fix if a patient simply cannot sleep with a mask strapped to their face? The reality is, the absolute best intervention is always the one that is both physiologically effective and humanly usable.
And this creates a major clinical tension. Just making a patient feel less tired doesn't automatically guarantee that we've neutralized their long-term health risks. For example, a patient might use some treatment that stops the heavy sleep fragmentation, so they wake up feeling super energized. Great, right? Well, if their airway is actually still partially collapsing and causing those silent oxygen drops, their risk for a stroke or heart failure hasn't actually been reduced at all. We really have to treat both the symptoms and the risk.
Because OSA is what we call a threshold disease, sometimes treatment isn't just about blasting the airway open with a machine, it's really about finding the right trade-off. I want you to think of a bucket filling up with water. The bucket only overflows when all those little drops combined push it right past the brim. So for some patients, just removing a few of those drops, like maybe changing their sleeping position to keep gravity off the airway, or just clearing up some nasal resistance, that alone is enough to bring them safely back below the threshold of collapse.
So, as we wrap up this explainer, I want to leave you with a bit of a challenge. From now on, you're no longer just looking at a snoring patient. You are looking at a highly dynamic system of loads, supports, and alarms. Whether you're navigating this for yourself or maybe a loved one, I want you to fundamentally re-evaluate your approach. Don't just ask how many times did they stop breathing. Ask the deeper questions. Where is the hidden harm actually coming from? And what is the absolute smartest trade-off to stop it?